Stevens-Johnson syndrome, or SJS, is a rare and serious disorder. It affects the skin and mucous membranes. SJS is a major health concern. Early diagnosis and treatment are critical. Understanding SJS is crucial for everyone. It helps in early detection and seeking timely medical help. This essay will delve into the causes, symptoms, and treatment of SJS. SJS is often unpredictable. It can affect anyone, regardless of age or gender. However, some individuals may be more susceptible than others. These include people with a weakened immune system or a genetic predisposition. The lack of awareness about SJS can lead to delayed diagnosis. This can result in severe complications and even life-threatening situations. Therefore, it's essential to educate ourselves and others about this condition. By understanding SJS, we can empower ourselves to take timely action. Early detection and prompt medical attention are paramount in managing this potentially devastating disorder. Stevens-Johnson syndrome, or SJS, is a rare and life-threatening condition. It's characterized by a painful rash, blisters, and skin detachment. SJS is a severe form of erythema multiforme. This is a hypersensitivity reaction that affects the skin and mucous membranes. The condition is often triggered by a reaction to medications or infections. In SJS, the body's immune system overreacts. This leads to widespread inflammation and damage to the skin and mucous membranes. SJS typically begins with flu-like symptoms. These include fever, sore throat, and fatigue. This is followed by a painful rash that spreads rapidly. The rash then develops into blisters, causing the top layer of skin to detach. SJS is a medical emergency. It requires immediate hospitalization and intensive care. The condition can lead to serious complications. These include sepsis, organ failure, and even death. Stevens-Johnson syndrome, or SJS, is a complex condition with various triggers. While the exact cause remains unknown, it's believed to be an immune-mediated reaction. This reaction causes the body to attack its own skin cells. Medications are a common trigger for SJS. Certain antibiotics, anticonvulsants, and pain relievers are known culprits. For instance, the antibiotic sulfamethoxazole trimethoprim is strongly linked to SJS. Similarly, anticonvulsants like lamotrigine and carbamazepine can also trigger the condition. Infections can also trigger SJS. These include viral infections like herpes simplex virus and mycoplasma pneumonia. Bacterial infections, while less common, can also contribute to the development of SJS. Genetic factors also play a role in SJS susceptibility. Individuals with certain genes, like HLA-B1502, are at a higher risk of developing SJS when exposed to specific medications. This highlights the importance of genetic testing in identifying high-risk individuals. Understanding these triggers is crucial for prevention and early diagnosis. If you experience any unusual symptoms after taking new medications or during an infection, seek immediate medical attention. Section 4. Recognizing the red flags. Symptoms of Stevens-Johnson syndrome. Stevens-Johnson syndrome, or SJS, presents with a range of symptoms, often appearing suddenly. Early recognition is crucial for prompt treatment and better outcomes. The initial symptoms often mimic common illnesses, making early diagnosis challenging. The first signs of SJS often include fever, headache, and muscle aches. These flu-like symptoms may be accompanied by a sore throat, cough, and red, watery eyes. These symptoms can easily be mistaken for a common cold or flu, leading to delays in diagnosis. As SJS progresses, a painful rash develops, spreading rapidly over the body. This rash appears as red or purplish patches, often starting on the torso, back, and face. The rash then evolves into blisters, causing the skin to peel off in sheets. The mucous membranes, such as those in the mouth, eyes, and genitals, are also affected. This leads to painful sores, ulcers, and difficulty swallowing. In severe cases, the skin detachment can be extensive, leaving large areas of raw, exposed skin. Recognizing these symptoms and seeking immediate medical attention is paramount. Early diagnosis and treatment are essential in managing SJS and preventing life-threatening complications. Section 5. Treatment and management. Navigating the path to recovery. Treating Stevens-Johnson syndrome, or SJS, requires a multifaceted approach, focusing on symptom management and preventing complications. Early diagnosis and prompt medical attention are crucial for a positive outcome. Hospitalization is typically required, often in an intensive care unit. The first step in treatment involves identifying and stopping the triggering agent, whether it's a medication or an infection. Supportive care forms the cornerstone of SJS management. This includes pain management, wound care, and fluid and electrolyte balance. Pain management is crucial, as SJS causes severe pain and discomfort. Analgesics, both oral and intravenous, are used to alleviate pain and improve the patient's quality of life. Wound care is equally important to prevent infections and promote healing. Fluid and electrolyte balance is maintained through intravenous fluids. This is crucial, as dehydration is a common complication of SJS due to skin loss and difficulty swallowing. In severe cases, additional interventions may be necessary. While there's no cure for SJS, early recognition, prompt treatment, and supportive care can significantly improve outcomes and reduce the risk of long-term complications.